Hi, I'm Alan Jope, Chief Executive at Unilever, and I'm delighted to be with Dr. Gerhard Seeberger, who is the brand new president of FDI, World Dental Federation. And we're having a discussion about the importance of oral health. Now, Unilever and your federation have been working together for over 14 years now, teaching good hygiene around the world. And one of the things that we're really becoming aware of is how important good oral health is for good overall health.
That's completely correct. And at this point, Alan, let me thank you for your engagement in Brush Day and Night and the initiatives that we had run in the last 14 years and helping us in coming closer to our vision, which is leading the world to optimal oral health. And where do we start? In the Brush Day and Night initiatives, we were addressing mainly children. And we did this mainly because we know that kids not only have fun by learning, but also the cognitive capacity of these young citizens of the globe is immense. And we could also say, first come, first remembered when they take their own decisions for their future lives. But why is children so important? It's important because we know that, and you have reported that in your SMILE report from 2019, that 1/3 of kids go to bed without brushing. We know that kids with a bad oral hygiene, they are not as performant in school. They're losing school hours due to pain. Some of them are not even taken by their parents to the dentist when they have pain, so this period staying at home with the pain lasts even longer. And the working capacity during the working life is less of those people who have bad oral health.
So not only is toothbrushing for children good in its own right, it leads to those kids doing better at school, showing up, socializing better. But there's also an issue around adults and getting adults to brush their teeth regularly. So this is not a children-only issue, is that right?
Oral health should be your best companion at all stages of life.
And even you were telling me there's a payback for society for investing in oral hygiene programs. How does that work?
That's actually a twofold answer that I can give. The one is, as you can lose school hours, you can lose also working hours during your working life. That's one aspect, which means that society, of course, is not as active in contributing to the gross national income, where oral health is not a main subject on the political agenda. And we know from other countries that have engaged in investing in oral health that they save approximately from $1 invested in oral health, $3 in expenditure to general diseases.
Amazing. So a dollar spent on good oral hygiene and good oral health saves $3 on treating other health issues down the road.
Yeah, that's what we know from statistics from Brazil, for example.
Fantastic. Well, I think that's the business case for investing in oral hygiene right there.
It is.
And is this part of the mission and work of the FDI is to promote good oral health in the context of good general health?
That's what we want to do, because oral health has been dealt with only mentioning it in silos, as other NCDs also. So everybody was thinking in his own cluster. And we really want to have a cooperation, as we know that the risk factors that are shared between the different NCDs, and this is mainly cardiovascular disease, diabetes, respiratory diseases.
NCDs is non-communicable
diseases? NCDs is non-communicable diseases, yeah. Said before, yes, but probably thank you for focusing on that, mainly because I think not everybody understands what that is. So, as I said before, cardiovascular disease, diabetes, some cancers and respiratory disease. This is the four main groups.
Those all link to
yes,
good
exactly.
oral health.
They share the same risk factors, and let's say the most important, generally known, are alcohol, diet, and tobacco, of course.
Do we know if it's correlation or causation?
That's a very good question, Alan. Well, we know that there is correlation for sure. On causation, science is working, and we, of course, want to have some more evidence. But to say that oral health, or let's say bad oral health or oral diseases, is causing directly cardiovascular disease, for example, there was a good initiative from an Italian researcher, Maurizio Tonetti, a periodontist, who was actually measuring what is happening when we are working on oral health and how does cardiovascular health increase. There's also a Scottish paper from 2011 where we see that daily toothbrushing, and now the both of us are in business, is actually ameliorating cardiovascular health.
Well, Scotland's got a good baseline to start with on
Yes,
oral hygiene. I'm glad you bring up the importance of daily toothbrushing. One of the beliefs at Unilever is that all of our brands must take responsibility for contributing somehow or other to making the society or the planet a little healthier. And of course, in the case of our oral care brands, that purpose is to drive better oral health, and hopefully that leads to better overall health. And so we've been now working for a number of years on this campaign to help change people's behavior so that we get consistent, high quality brushing twice a day in parts of the world where that's still not normal. And we really appreciate the work that FDI is doing with us on that. Is that partnership of value in your mission?
Yes, it definitely is. You're focusing, or we are focusing actually with the Brush Day and Night initiatives on those who are the best learners. And I think we are both the one that pushes the door open for the other. There is no question that with the technology that you deliver to the dental or to the oral health profession is precious. And I think we both engage also in helping people to make healthier choices or healthy choices.
Yeah, we also believe at Unilever that business doesn't have to be serious, it can be fun. And one of the most fun days in our calendar is World Oral Health Day, where we're able to go out into schools literally in all corners of the world and work with young kids, and they can learn how to embrace new habits. And so we love the fun around World Oral Health Day, but I guess there's quite a serious message and intervention around that day in the year.
Absolutely, yes. Of course, in FDI we're very proud because we know that we had 2 billion reaches in 2019 with World Oral Health Day. It's increasing every year, and we're looking forward also.
Just say that again, 2 billion?
2 billion,
There's
yes.
only 7 billion and change people in the world.
It's 7.7, a little slightly over it.
So this year, can we get to another 2 billion, do you think?
Oh, yes, I think so. And cooperating even, let's say, with more excitement, I think we can even, let's say, go far beyond the 2 billion reach.
Okay, good. Well, we're up for it. It's fun, it's important, it's good for oral health, and it's good apparently now for general health. So here's to a great World Oral Health Day in 2020. Thank you so much for gracing us with your presence, and good luck in the new job with the FDI World Dental Federation.
Yeah, you
nice
too,
to...
and I think we have a great opportunity to reaching even better results.
Great, thanks a lot.
Thank you.